Hello, everybody, and welcome to another episode of the Practice Pulse podcast. I am your host, Dr. Aditi Agarwal. I'm a general dentist as well as co founder of Practice by Numbers. And today I have the wonderful pleasure of meeting with Miss Ann Marie DePalma. She is a hygienist by trade, but a heck of a lot more than that. So welcome, Anne Marie.
Well, well, thank you, Dr. Aditi. I'm so excited to be part of the podcast, and I welcome everyone to our listening audience. I am a hygienist, as you mentioned. I've been a hygienist for many years, too many to count, and I've done so many different things. I've had a varied journey in dentistry and dental hygiene.
Yeah, no, absolutely. I was looking at your bio and really impressed by your journey into dentistry and how you're still journeying through dentistry, which is pretty amazing.
Yeah.
And so tell me all about it.
So I practiced clinically in perio and general practices for a number of years. And when I was in hygiene school way back in the dark ages, I swore up and down I would never work in a perio practice. But that's where I spent most of my clinical career and enjoyed it because I got to see both hygiene and the assisting component. The periodontists that I worked for, I was able to see some hygiene patients, but most of the day I was assisting docs and doing perio surgery, doing implant surgery, taking out sutures, all of the
Mhm,
periodontal aspects of working in a perio practice. So
mhm,
that was great. From there, I had the opportunity to teach in a dental hygiene and dental assisting programs, which were great opportunities to enhance my educational experiences. And through there, I ended up working for a large dental vendor, Patterson,
mhm.
as a software trainer for EagleSoft.
Wow.
So I spent a number of years with Patterson as a software trainer and did EagleSoft, did Fuse, did CAD, a little bit of CAD CAM, did imaging, all of that. So I took my educational background and pulled that forward. Unfortunately, there was this little thing that happened called COVID. I don't know if people have heard about it,
Right.
but as a result of COVID, um, as a lot of companies, Patterson had some changes post COVID, and
Mhm.
I ended up being one of the changes. So I ended up taking a position with an AI company and
Wow.
worked. Yep, I worked there for Pearl for a short period of time, and then went and did some contract work for a small dental DSO in the area. I live in the Boston area, and I had known this practice from a EagleSoft perspective. I had trained the office and their team over EagleSoft, and now they were looking for a training manager, but it was a contract position. So I
Mhm,
developed training manuals for the team in terms of administrative aspects of the practice, in terms of clinical aspects. And then from there, I decided that I'm going to focus, I enjoy education. And
mhm,
over the course of my entire career, I have always done some CE, whether that be presenting on a number of different topics or writing. So, as a result of the contract position and really enjoying that piece of practice, I
mhm.
decided that I was going to spend most of my career now as a speaker and a little bit of consulting as well.
Wow, that's an amazing journey that how you have moved from the clinical aspect of dentistry, knowing the skills that it takes in the clinical aspect, applying it to education, applying it to training, applying it to even software, both in AI as well as in just regular software, and training teams in how to use all these things. I mean, our journeys are very similar then.
Dentistry is not a straight line. There are so many curves and twists that can occur in one's clinical and administrative career within dentistry. You
Right.
may think you have one goal. When I graduated hygiene school, working in private practice I would never have thought I would be a CE speaker.
Right. I mean, look at that, right? It's
Exactly.
amazing where, when you say yes to some things,
Mm,
where the life takes you.
that's
So
right.
that's really amazing. And like I said, very, very similar. Journeys. Tell me a little bit about, let's talk about the clinical aspect. I know you're a very passionate speaker about TMD. So let's dive right in because I know that both you and I love bread and butter, and clinical is where our true passion is. So let's
Right.
talk about that.
So, as I mentioned, all throughout my career, I've been interested in providing continuing education for teams. And the way that started was actually through me. All of my programs are geared for the dental teams, and all of them have had experiences that I have had through clinical or through personal experiences. So, in terms of TMD, I was working in one of the periodontal offices, and one day I just couldn't open. I was closed locked. And when this particular periodontist also treated TMD. And as a result, he started treating me. But yet, there were days I would be perfectly fine, and then there were other days I'd be closed lock, I couldn't open, or I would be in severe pain. And so over the course of time, I was trying to find information. As a hygienist, I wanted to know what was going on in my own situation. Now, I think I'm a pretty smart person,
Mhm,
but what I was finding was either way above me or way below me.
mhm,
And I couldn't make sense of what was happening to me.
mhm,
So, through all of that, I decided to create a CE program as well as writing for a variety of different publications about TMD and TMJ.
mhm.
And over the years, I have had basically most of the treatments that are available in terms of appliances, in terms of injections, in terms of physical therapy and surgery.
Mm.
Surgery is a last resort for any patient,
Right.
but I ended up having to have had surgery. When I was going through all of the process of TMD, I had to have my right disc removed. So when we talk about the joint, we talk about the temporal bone of the skull, the condyle of the mandible, and in between there's a disc or the meniscus, very
Mhm.
similar to your knee.
Right.
And over time, for me, that disc perforated
Mm.
and had to be removed.
I see.
So I talk about my journey, and then I talk about the basics of TMD. What it is, the etiology of it, the anatomy of it,
Mhm,
various types of treatments.
mhm,
What is surgical treatment versus non surgical treatment?
mhm,
All of that from a clinical aspect as
mhm.
well as from a personal story.
Right. No, that's amazing. And for our listeners out there who are wondering what is TMD and TMJ, TMD is temporal mandibular dysfunction. That is this joint right here. And or TMJ is the joint, the temporal mandibular joint. So where the temporal and the mandible kind of connect, that joint is called the TMJ. And the dysfunction to that joint can lead to locked jaw, and that is one of the severe sort of problems. And like Anne Marie was saying, there's a lot to it in terms of understanding what causes the different kinds of TMJ problems are different kinds of TMD because there are different modalities of treatment based on the severity of your TMD. And it's amazing that you've created courses to be able to really understand that, and the fact that there are multiple causes, and the fact that, there are multiple ways of treating TMD, and one size doesn't fit all, right?
Exactly. And there's so much controversy surrounding TMD, temporal mandibular disorders.
Mhm,
Even recently, there was a problem with an appliance that was being used that was touted as being the cure all. Well, it created more problems than it solved.
mhm,
So, all along the course of history,
mhm,
and actually, TMD research hasn't really, is still only in our infancy,
mhm,
in terms of what we know about it.
mhm,
So there's a lot of patients
mhm,
are tend to be women in their
mhm,
childbearing years.
mhm,
Men certainly get it, older people certainly get it, but the majority of patients occur in that 20 to 40 age range.
mhm,
And I have a number of different programs as we'll talk about, but one of the other programs that I do is on women's health. And we talk about the role that TMJ and TMD play in women's health because of the hormonal relationships that occur within the joint.
Yeah, no, that is very, very true. I mean, and I think in my practice, and just as a practicing dentist, that's one thing that I have been noticing as well, that how hormones, shifting in hormones is, I think, directly related to changes in our, of course, our physical body, but also changes in the flora and fauna of our teeth, of our mouth.
Exactly.
And all of those can lead to, various components of oral health being triggered, and causing, TMD as one of the issues. And definitely hormones, I think, is one of the things that is not even really studied on, because even I noticed caries risk changes every time there is a hormonal shift in a woman.
Mhm.
Every time a woman has a baby, every pregnancy, every lactation, when they hit menopause, when they hit puberty, if they start looking at caries indicators even during these shifts, I mean, you know, it
It's
would be
amazing.
so cool. It's so amazing to see, really,
Yeah.
that the things
Those
that
three
we're learning.
times in a woman's life, puberty, pregnancy, and menopause, are when conditions occur that may not have been present previously.
Yeah,
For example, the TMD or the caries increase. All of those things happen
yeah,
during extensive times when hormones are either shifting up or down. So great.
exactly.
Yeah.
Exactly. And I don't think there's anybody really studying that. Or maybe there are people studying that, but we don't know yet. But it's not very mainstream, but definitely there is a correlation.
Mhm.
So I applaud you for really digging deep into this, because it's needed,
And
you know.
like I mentioned, it's not just a clinical course. Yes, I talk about the clinical aspects, but all of my programs are geared for the entire team. Whether you're a doctor, a hygienist, assistant, admin team member, all of my programs, I've had a number of programs that I present where I've had doctors in where it's been on the hygiene program, or I've presented a program for assistants and admin team members have been in the program, so all of my programs are geared as entire teams. And that's the best way of learning, whether it's, just one person from a team, from an office, attending the course who can then take the information back to the practice
Mhm,
during a team meeting,
mhm.
but it is all for everyone, all of my programs.
That's awesome. That's awesome. And on the topic of women's health, most women are the caregivers for in terms of the emotional caregivers for their families, particularly the kids. It's the moms generally who make the appointments for the kids. And so it would be interesting to hear your perspective about, the childhood development delays and what you are noticing and what you are talking about when it comes to these core things, I think, that should be addressed when talking to parents about childhood development.
So I worked for years in perio practices. I never saw children, or if we saw a child, maybe 10, 12 years old for a canine exposure. But I
Mhm,
was never really exposed to the younger child. And we know that the first visit for children should occur at age 1 or when that first tooth erupts.
mhm,
So having parents come in, as a hygienist, I don't know if I'm going to be able to do a prophy on a 1-year old, but
mhm,
I'm there to educate the parent and the caregiver. And that's what I was doing in the perio practices. I would be educating the parent, caregiver, aunt, uncle, grandparent, all of that I was seeing in my hygiene or perio chair. But in this particular program, we talk mostly about speech and language, a little thing that we might know a little bit about being oral healthcare professionals,
mhm,
and motor delays that a child may exhibit during those early years, 1 to 3, 1 to 5, those types of things. And what parents and caregivers and everyone involved in a child's life should be able to recognize, is there a problem with speech and language? Is there a problem with motor skills? So I tell a story in the program about a mom who was going to go back to work quickly after she had the baby and wasn't able to devote time to breastfeeding, although she knew breastfeeding was going to be important,
mhm,
but she couldn't do it. And during the after the baby was born, the nurses in the nursery tried to give the baby a bottle, and for whatever the reason, the baby couldn't attach to the bottle. They brought the baby to mom, and knowing that she wasn't thrilled with breastfeeding, but they said, "Let's attempt it." So
mhm,
they managed to do that, and then in the evening, when the baby was, time for the evening nutrition, mom was sleeping, baby's in nursery, they tried a premature nipple. Now,
mhm,
the baby was able to get that, even though it was a full term delivery, the baby was able to get that nutrition. Now,
mhm,
mom completely forgot about that until the child entered preschool, where they were screened for motor and speech and language delays. And the child seemed to have moderate motor delays.
mhm,
And the mom had to fill out paperwork about that, forms about, what what was the beginnings of life, what happened at birth, was it normal, vaginal, whatever, or C-section. And that's when she remembered that there was a problem early on. If
mhm,
that child had received services, then they may not have been at that place where they were when they entered the preschool. So having the understanding of some of the issues that surround it, and basically, again, the way I got involved with looking at all of this was my children, who are now adults,
mhm,
were actually diagnosed with speech and language and motor delays.
mhm,
And when I was talking to their therapists throughout the course of their treatments, when they found out I was a dental professional, they were amazed. They said, "You're a perfect person to educate other dental professionals about what to look for." Now, we can't diagnose a speech and language issue, that's beyond our scope of practice. But what we can do is refer them to
mhm,
appropriate resources. So that's
mhm,
what I talk about. What is a speech and language? What is a motor delay? What are the referral sources that we can use? And how we as dental professionals can educate, and our role in education about
mhm.
speech and language and motor delays.
Absolutely, absolutely. We play such an important role, especially nowadays with the big connection with airway development and breastfeeding, to be honest.
Mhm.
There is a massive push for breastfeeding, mainly because of airway development or tongue, the position of the tongue, which in turn leads to proper breathing and airway, and decreases the chances for sleep apnea in
Right.
pediatrics. And it's such a huge like aha moment. Like when I took that class and I um, uh, understood the relationship, it was just it was so simple. It was so simple that I was like, wow, why do we not teach this? Because the general public should understand this, because this will decrease a lot of problems for that child as they grow, as they develop, and in the school years, because you usually don't find out about sleep apnea in kids till they're in school.
Hmm.
And by then you're avoiding things like getting surgery done for adenoids and tonsils and this and that, simply by just figuring out the tongue position in infancy. So that is, and it's really important as for us as dental professionals, whether it's assistants, whether it's the dentist, because the assistant would see the child too. They should be, two. I always say, two sets of eyes is better than one. So,
Hmm.
and we definitely have a team in dentistry, so why not use that team, educate that team to when that child comes in, usually to the dentist at year one or at first tooth, whatever. If you notice a tongue tie, you see it, address it, at least talk about it, talk to the parent, refer them, get them checked out, because even though the parent might be hesitant at that time, think about how much time, energy, and pain you're saving both the parent as well as the child later in their school years. Because I have been through that personally with my daughter, so I totally understand where you're coming from and how important it is to push this education not only to dentists but also to the teams. So
Right.
thank you for doing that.
Yeah. And as you're mentioning, the tongue tie, the tonsils and adenoids, sleep apnea, all of those things I talk about in the program. So that's awesome that we're on the basically on the same page. I love
I
that.
told you, Ann Marie, we are completely aligned.
Right.
Yeah, because as a mom and as a dentist, I'm fortunate that I was a dentist, because
Mhm.
I recognized sleep apnea in my daughter early on and I took early action. And so, didn't have to wait till she was preteens to even figure out that something's not right.
Right.
So,
Even me as a mom and as a hygienist, my older son, it was our daycare provider who actually diagnosed and said, "Okay, there may be something going on." I was a first-time parent. I was reading all the books. The pediatrician said everything's okay. He's a boy. Don't worry about it. That type of thing. And it wasn't until my daycare provider mentioned, hey, I'm looking and seeing these things that are happening with him. Maybe you should have him evaluated. And we
mhm,
did.
mhm. Absolutely, absolutely. And there is a slight disconnect, unfortunately, as we all know, with the pediatrician as and the oral cavity.
Mhm.
They are, their l- view or looking point for development delays is more drastic compared to us as dentists. We
Mhm.
look for the little things, they look for the big things. And so sometimes if we catch the little things before they become big things, we have saved a lot of people a lot of headaches and a lot of, pain and struggle in their journeys. And so I always tell everybody, to everybody listening out there, you know, educate your teams. You need that second set of eyes to help you understand, show them what a tongue tie is, show them what a normal, tongue position looks like in an infant. There's a lot of literature out there nowadays for you to look it up really easily and share that with your teams because it's important. If they see it and you see it, say something. And, at least you have taken that one step toward being responsible for the whole health of your of your patients. So thank you for so much, because that's a passion project of mine. I've been through it as a parent, and if one person is saved by the hassle of all the things that come later, then we've already won. So
Exactly. Yeah.
I really appreciate that.
Yeah.
um, you know, Now we're going to talk about the technology space, because we've talked about clinical, and I love tech. So,
Mm,
what
just a
are you?
little.
Just a little. What are you seeing in the AI space, Anne Marie? Because I know you speak on AI. So,
Yeah. So AI is around us every day. Artificial intelligence is part of our everyday lives, even if we may not even think about it. So, what I do when I talk about it in programs is there are so many great products out there. We've all heard of ChatGPT or some of the imaging products that are out there, or, Practice by Numbers has an AI component to it as well now. But there's so many different aspects of it. It's not just one thing. And that's what I explain to people. I bring it down. I call it AI 101. I,
mhm,
I basically dumb it down. I was having a conversation a number of months ago with an AI developer,
mhm,
and he was talking algorithms and all the computer jargon. And I'm like, no, don't go there. Bring
mhm,
it down. What does it mean to me? And how important is it for me to use it? Where do I use it? Both in my personal life and in my professional life. How do I use it? So basically, with my program, I talk about all of the different types of AI that are out there, where it actually came from. We
mhm.
think it's this great big new thing that's out there. No, it hasn't been. It's
Yeah.
been around for many years, and it's now just coming into mainstream.
Mhm,
So, where it came from, how medicine is using AI,
mhm,
and then looking at it in terms of dentistry and
mhm,
how it can help both our practices and our patients engage in their treatment, in their education, and in the practice productivity and profitability.
mhm.
Dentistry is a business, no
Yeah.
matter what we say in terms of helping people. That's why we all got into dentistry. We
Mhm,
want to help people. But dentistry is also a business. So AI can help manage the business aspects of the practice as well.
yeah.
Now, is it ever going to replace us? Hopefully not.
Mhm,
There are robots out there that are doing some amazing things. But in terms of the person, we need that one to one interaction with our patients. And
mhm,
that's never going to change. In the
mhm,
program, I have a video that talks about, will AI replace dentists?
mhm,
No. And it's not going to replace the hygienist or the assistant or the admin team members. I know a lot of admin team members are afraid, you bring AI into the office. What am I going to do? I'm going to lose my job over it. No, it's
mhm.
actually giving everyone on the team time back.
Yeah.
It saves time. It gives us that extra time that we didn't have, that
Yeah.
we can focus on our patients.
Mhm. Yeah, absolutely, absolutely. If somebody would have asked me 10 years ago, what would be the best gift ever? And I would tell them time, because my kids were young, and my practice was young. And even though I was young, I felt really old, because there just was never enough time for me. And, as a provider, as a healthcare provider, we give in many different ways, right? We give to our patients, we give to our colleagues and also staff members, we give to our kids, we give to our spouse, we give to our physical locations of actually our home as well as our business. And then when we've been giving, and there's only 24 hours in a day, and you pretty much, I think I've touched onto every aspect of your sort of journey that you have to give at or give to every single day. This is a role that you have to give to every single day. So you're giving the two 7 or 8 pieces of a little pie every single day, and you are holding that pie. You
Mm,
have no time for yourself. And that can lead to a lot of frustration. It can lead to burnout. It can
mm,
lead to um, depression.
mm,
And, you know, what if somebody had given me that gift 10 years ago? I would have been the happiest dentist on the planet.
mhm,
And now, with AI, with these multiple resources out there, we are able to give the gift of time, or get the gift of time. For me, maybe 10 years a little late, on the later end, but I say better late than never, right?
that's right.
I'll
Mhm,
take it.
yep,
But so now that we have these sort of uh, technologies available that can give you this gift, you know, use it. You have to understand what they're there for, and you have to talk to your teams about it. Because if you do not communicate to your teams and tell them what these technologies are going to do for you and for them, only then there is power in jumping. Otherwise, all you're going to get is resistance. But
mm,
doctors out there who have their own practices, you know, I really implore you to have that conversation with your teams. And it's great to have new technology, right? It's wonderful. I mean, look at the scanners. We were not using scanners just, 10 years ago. They were not mainstream. Look at them now. And what has it done? Saved time, right?
and it builds trust with our patients.
Yeah.
Patients are looking for practices that use technology, and that technology, how many times people come to us and say, "Oh, Dr. Google told me A, B, C, or D," They trust technology over trusting us as dental
Yeah.
professionals. So, it's important to, engage, as you said, the entire team. As a software trainer going into practices, oftentimes, I would go in and I would, say, "I'm the trainer here to show you the new software." And people would look at me like, "No, my inner 2-year-old's going to come out. I'm stomping my feet. Why are we doing this?" Well, having that conversation as a practice owner, as the doctor, explaining how technology, whatever that may be, whether that be a software, a scanner, or AI, is going to help the practice, help the patients. In my programs, I have a slide that says, "What's the number one priority in any dental practice?" It's the
Yes.
patient. We're there for the patient. Yes, we're a business. I get all of that. But we're there for our patients. We have to look at our information that we gain from our practice management software, or other types of software, as key KPIs,
Mhm.
gaining all of that KPIs to understand the business of our practice. But yet, without patients, our business and those KPIs wouldn't mean anything.
Right. Absolutely. Absolutely. It is, without the patients, we are nothing. We don't exist, or we exist in just out there. So it is very, very important to have communication skills and to communicate with your team about whatever you want to bring into the practice, because remember, it's not you, but your team that's going to sell anything and everything for you. And also, it is your team that will keep your patients happy on the long run. So, happy patients, happy practice.
Yep. I love it. Mhm.
So that that is the key piece of this is, communication and education. And it should be team focused, not just dentist focused, or not just owner focused, because really they can drive a lot more than honestly most people realize. So, Anne Marie, we are so aligned. It's so amazing to talk to you about all this stuff because it's really up my alley. So thank you for bringing me up, and thank you for coming
Thank you
on
for
today.
handling all of this. I love
No,
it.
absolutely. This is so heartening and so heartwarming. If our listeners want to reach out to you, how can they do that?
So my website, it's my name backwards. It's depalmaannmarie.com. Or they can reach me through email, depalmaannmarie.com, or on LinkedIn.
Awesome. Well, this was such a wonderful pleasure. Thank you so much, Anne Marie, and I look forward to seeing you on the road.
Yeah, same here. All right, take care.
Take
Bye
care.
bye.